This is my ethical reflection recording. During this clinical experience at Office C, I saw patient A who was coming in for her 4-month recall appointment. As part of her routine visit, she was due for radiographs, so I began by taking 4 bite wing x-rays. After reviewing the images, I spot checked her probing depths and noticed that there were some areas with deeper pocketing and bleeding. Because of those findings, I decided to look more closely at her previous radiographs. When I reviewed them, I noticed radiographic calculus present on some of her anterior teeth. After seeing this, I asked hygienist B if she thought it would be beneficial to update the anterior radiographs as well. She agreed that it would be a good idea to gather more information, so I proceeded to take 6 anterior PA radiographs. After evaluating these additional images, I confirmed that radiographic calculus was still present in those areas. At this point, I had to think carefully about how to proceed. This situation involved several ethical principles that we have discussed in class, including autonomy, beneficence, non-maleficence, justice, and veracity. As a clinician, I knew it was my responsibility to communicate the clinical findings clearly and honestly to the patient. Veracity is truthfulness, and it required that I explain what I found and what it meant for her oral health. I also had to consider patient autonomy. Even though I may recommend a certain treatment, it is ultimately the patient's right to make decisions about their own care. My role was to provide her with accurate information so that she could make an informed decision. Beneficence and non-maleficence were also important factors in this situation. Beneficence means acting in the patient's best interest, and non-maleficence means avoiding harm. Continuing with a routine 4-month recall would not have addressed the calculus that was present below the gum line. If I simply completed a regular prophylaxis, it could potentially cause harm by leaving disease-causing buildup in place and allowing periodontal issues to progress. Because of this, recommending SRP was the treatment that would best support the patient's oral health. Justice was another principle involved in this situation. Justice refers to the fairness in providing appropriate care based on patient's clinical needs. Even though the patient had been attending her 4-month recall appointments consistently, the presence of radiographic calculus and deeper pocketing indicated that a different level of care was necessary. Recommending SRP ensured that she was receiving the treatment that matched her clinical condition. Once I had thought through these considerations, I explained all of these findings to patient A. I told her what I had seen on the radiographs and during periodontal assessment, and I explained that the buildup under the gums could not be effectively removed during a regular cleaning. I let her know that the recommended treatment would be a deep cleaning, also known as scaling and root planing. I understood that this information could be frustrating for her to hear, especially because she had been attending her recall appointments every 4 months and likely felt that she was staying on top of her oral health. Because of that, I tried to approach the conversation with empathy and understanding. I made sure to give her time to ask questions and express that my goal was to help improve and maintain her oral health in the best way possible. After discussing the treatment and answering all her questions, I obtained her consent to proceed. Once she agreed, we began her scaling and root planing during this appointment. Reflecting on this experience, I feel that this ethics course has strengthened my confidence in making ethical decisions in the clinical setting. It helped me think through the situation in a structured way and consider how different ethical principles apply to real patient care. I believe that I followed the ethical decision-making process by gathering the necessary information, evaluating the patient's needs, communicating honestly, and respecting her ability to make decisions about her treatment. Looking back on the situation, I do not think I would have handled it differently. I feel that I acted in the patient's best interest while also respecting her autonomy and ensuring she had the information she needed to make an informed choice. This experience reinforced the importance of ethical decision-making in dental hygiene and reminded me that patient care involves not only clinical skills but also honesty, fairness, and compassion.